Today I'm going to review trach care, doing stoma care and suction your trach. And when you go in, make sure you wear the appropriate PPE. So, you want to listen to wash your hands, put your gloves on, listen to the lung sounds, get a pulse ox, make sure the patient's vital signs are okay. Tell the patient what you're going to do. And what you're going to do, open your trach kit, which has that sterile drape, but you don't have to be sterile unless they have an autoimmune disorder. Just keep it as clean as possible. You've also got a brush in here to clean the inner cannula, if they have one that is not disposable. And you have Q-tips to clean around the stoma. You've got a split gauze, and you've got 4x4s. You're going to take saline or distilled water, whichever you use in your facility. You're going to pour it into these little container. You pour that, okay? Now, I'm going to tell the patient what I'm going to do. If they're on oxygen, have them take some deep breaths. Hook the cannula up to suction. And a cannula is good for 24 hours. After that, you want to throw it away and get a new one. So I got my saline in here. I'm going to put my finger over the little hole here, and I'm going to suck some saline up. And that's going to lubricate this so it'll go in easier. Okay? So I'm going to, don't put my thumb back over it though. I'm going to tell the patient what I'm going to do. And as I go in, I'm going to hold my breath. I'm going to hold my breath the whole time I'm doing the suctioning. And it should not take more than 5 seconds. If you're having trouble breathing because you're holding your breath, you know they are because you're sucking their air out. So you're going to go in to the back of the trach or until they cough. So you go on in and then you put the suction on. And you're going to twirl it around as you bring it out. Then you're going to suck up some more saline to clear it out. If there still need to be suctioned again, wait 20 to 30 seconds, have them take some deep breaths. If they're on oxygen, put the oxygen back on, and then you can do it again. You can make sure each time you clear it afterwards. You could do it up to 3 times. Okay, so then after you clean this, you're going to put it back to the side. Like I said, it's good for 24 hours. Now, I'm going to do my stoma care. We used to put peroxide and saline. Now we just use saline. The peroxide was causing some other problems and causing drying and all kinds of irritation. So we're going to take the dirty one off, dirty split by 4x4 off. I'm going to anchor this, and this is one that we clean. This is not a disposable one. Anchor it lefty-loosey, take it out, put it in the container of saline to let it be soaking. It could soak up to 5 minutes, so don't be in a rush. They can still breathe. They still have their inner cannula in. Okay, once I do that, I'm going to take my gloves off, clean my hands with alcohol, put new gloves on. Okay. Now I'm going to do my stoma care. So I'm going to take the saline here, cotton swabs, and just go all 4 quadrants. Start at the stoma and go out. And here. And then one more time here. Now, if it's too wet, make sure you dry it with a 4x4. If you need more cleaning, you can use a 4x4 and moisten it and clean around it. If you need to change your collar, you can do this at this time. Don't leave it on if it's dirty. It's usually changed at least every 24 hours. If it's a new trach, it's going to drain a lot. So make sure it's always clean around the stoma. We don't want it getting crusty or having an odor that we need to clean it more often. Sometimes you might have to do it 2 or 3 times a day, clean it. Okay, so in the meantime, I finished that. I'm going to take my little brush and I'm going to brush my inner cannula. And I clean that and put it in the clean container of saline there. Rinse it, tap it off, hold it down, insert it. Oops, no, I want to go sideways. And righty-tighty, the 2 little dots should be beside of each other, okay? Okay, now we're going to put a 4x4. If you do not have a split 4x4, do not cut one. You could get fibers inside the trach if you did that. So don't ever cut it. If you don't, you can take a normal 4x4 and you can fold it and put one on each side. After they've had a trach a long time, unless they've got a cold, they probably won't need a 4x4 anymore. But at first, they have a lot of drainage, and that's when you're going to need it. And sometimes it's not real pretty. It's not easy to get into there. Now, if the person, some people like to use the disposable ones because they don't want to take time to clean them. And the disposable ones look like this. And it says, do not clean or reuse. Those they can just take out, You have to clean it, throw it in the garbage. They have a new one. You just get a pack of 10, and they put the new one right in, and that's all they have to do. So, these cost a little bit more, but they are more convenient to do it that way. But you can't use a disposable one in one that's not disposable. So